Good afternoon. Thank you so much for joining us for our Poverty Task Force webinar. As you know, we have had some great successes. I hope that everyone had an opportunity to look at the report that we sent out toward the end of December, just talking about our first two policy reports in 2021 and 2022, and some of the some of the movement we've had on those policy recommendations in 2023. We decided to use 2023 to really focus on getting some of those policy recommendations enacted. And I have to say, our legislature has been just really great about getting us some great wins. And so we thought it's early in the budget season, still a little early, maybe early is not the right word, but it's, the governor just presented her budget on February 7th. So we thought in the month of February, it'd be a good opportunity for us to talk a little bit about some of the things that the governor is proposing that we think will have great impact for struggling Michiganders. And so for that conversation, we have invited Algeria Wilson, who is Governor Whitmer's policy advisor who specializes in health and equity. Since joining the team, she has advanced Michigan's efforts around jail deflection and diversion, along with protecting reproductive freedom for 2.2 million Michiganders. Most recently, she served as Director of Public Policy for the National Association of Social Workers Michigan chapter, where she drove public policy on behalf of 30,000 social workers. She gained her foundation in love for public policy as an alternative sentencing social worker at the Department of Public Advocacy in Kentucky and as a legislative intern for now Michigan State Senator Stephanie Chang. Her passions include criminal legal reform, behavioral health, and advancing racial and social justice. She holds a bachelor's degree in social work from the University of Cincinnati and a master's degree in social work from Michigan State University. She is the proud mom of one daughter, a native of Cincinnati, Ohio, and has enjoyed calling East Lansing her home. So we are really happy to invite Algeria. Algeria is someone that we work with a lot here at the Poverty Task Force. And we asked her to share with us today, again, some of the what we consider to be budget wins for low income and for struggling Michiganders. And I'm just going to turn the program over to Algeria to share some of that information. Thank you so much again, Algeria, for joining us.
Oh, thank you for inviting me. Thank you, Kim, and good afternoon, everyone. So today I'm going to just present a little bit on the governor's executive budget recommendations. I'll go over a variety of the budget, but I definitely want to spend most of our time today talking about recommendations that really will affect some of the recommendations that the Poverty Task Force has focused on, and some recommendations that can really help move the needle for our lower income Michiganders, our ALICE population. So I will share my screen here and we will get into the presentation. All right.
So, Algeria, before you start, I just want to ask our audience, if you have questions, please don't hesitate to put them in the chat, and we will ask them at the end of Algeria's presentation. Thank you.
Thank you. So the governor's executive recommendation, her presentation occurred on February 7th. So if you were not able to see that, I'd highly encourage you to go back onto the Senate or House TV and to take a look at that. All of the documents related to the budget can be found on SBO Michigan's website. And it can give you just a little bit more detail about the items that I'm going to discuss today. But when the governor presented, she talked about how this budget focuses on 6 core areas. Balancing Michigan's budget so we can actually have more funding to do some of the amazing work that she is proposing. Lowering costs, with inflation is a very important topic for Michiganders. We want to continue to reduce crime and make sure that Michiganders are healthy. Education, which is something that I know this task force has been very supportive of and trying to push for improvements in that space. And we've been focused here on this budget to improve education and outcomes for children. We're focusing on Make It in Michigan, which is more around entrepreneurship and innovation for jobs and workforce. And really also to make sure that Michigan is more fair and equitable as it relates to particular subpopulations. So I'll start with lowering costs. You may have seen that we're focused on rolling back the retirement tax. And it is something that the legislature will really have to focus on. But it's a way in which we can help seniors save hundreds of thousands of dollars. Our Working Families Tax Credit is something that the governor has focused on, and I believe this week we have began to roll out over 300,000 checks. You may see that across our social media platforms. We're proposing a Caring for Michigan Family Tax Credit, which I'll get into here shortly. We know that unfortunately too many of our seniors struggle to age in place, even though it is a desire of theirs. And we see the struggles that many of their family members have when trying to assist them with their funding and how much family members actually lose in wages because they're paying for an aging or sick relative. So our Caring for Michigan Family Tax Credit is really supposed to help support the family members who are caring for our seniors and individuals who may have longer term needs so they can age in place and not have so much stress and strain on them as they are providing caring services. There'll be a Michigan vehicle rebate is something that we're proposing as we begin to shift towards more EVs in the state. And housing, we know that housing is critical. Affordable housing is something that is of continuous need, not only just in Michigan, but across the US. And so the governor is proposing rehabilitating and building over 10,000 homes in the state of Michigan. So I want to share a little bit about our Caring for Michigan Family Tax Credit. For our Caring for Michigan Family Tax Credit, we're setting this up where families can save around $5,000 per family. They'll be able to write off certain services, such as adult daycare, transportation, different durable medical equipment, hearing aids, even counseling services that they provide and pay for. Some of the requirements are you have to, as a caregiver, have an income of at least $7,500. We don't have any income restrictions currently. And so long as you pay for expenses that exceed $2,000, you can get 30% of that back. It won't be a refundable credit, but it will be the ability to save on your taxes each year. This is our state proposal. It is mirrored off of the federal legislation that is put out there, along with some of the administrative costs to set this up, which are inside the budget. We really need to make sure that the legislature is focused on getting the legislation across and through the board. And so that is something that we're working really hardly and strongly with advocates for. You may see that in the coming weeks here, but we really want to make sure that we are focusing on our seniors and allowing them a place to stay in their homes as they age because of some of the challenges and costs associated with long-term care services and supports. Next, as we think about reducing crime and keeping Michigan healthy, the governor has invested in this area for quite some time now, as it relates to, jail diversion, our diversion courts, our first responders, our state police. So some of these investments are not new, but they continue to expand. Last year and this year, we have additional investments in community violence intervention, which I'll talk about But here are some highlights for some of the items that we are making some investments in. So more local first responders, so police officers, firefighters, EMS providers, which we know are so critical to getting individuals to and from our hospitals, especially in our rural areas. Hiring more state troopers so that we have a new and improved class of troopers coming into the workforce. We're focused on community violence intervention. We're improving our statewide emergency system and really trying to support our locals with additional funding and revenue for some of these services. Just a little bit more on public health and safety. So our community violence intervention funding is something that each state is really trying to set up and trying to think of alternative ways to reduce violence, gun violence, and other forms of violence across the state. So we'll have $500,000 in funding and GF funding in the budget, and we'll have another $5 million of ARPA funding to be able to provide funding to community-based organizations. So some of this funding will be, to support the capacity and buildup of these programs, and other portions will make sure that local communities who are doing this work have the funding they need on an ongoing basis to implement some of the ideas that they have and work that they're doing to reduce violence in the community. And this is really an effort to look beyond some of the previous efforts around law enforcement. We're going to continue to fund some of our sexual assault and victim services initiatives. There will be $2 million in the budget for that. Really focusing on smoking prevention and cessation. As we look and see more challenges around tobacco and vapes, we want to make sure that we are supporting individuals who experience some of those challenges. And then as well, firearm injury and violence prevention grants as well, which coincides with some of our efforts around community violence as well. Going on to some of our healthcare initiatives, very excited about what we have here in behavioral health. The governor's been really investing year after year in mental health services, behavioral health services, even beyond our opioid settlement funding. We've been focused not only on just expanding the services that we offer in this space, but also focusing on workforce. So this year, we are continuing to focus on workforce and continue to focus on expanding access to services. So this year in the budget, one of our largest proposals is to expand our certified community behavioral health clinics, our CCBHCs. We're looking to expand those to around 12 to 13 sites. And it'll give access for Michiganders to around 50,000 Michiganders to be able to access these services. I think many of you probably know what our CCBHCs offer, but they are intended to be a one-stop shop for mental health, substance use disorder, and physical health care services. And they've seemed to be successful. Michigan was one of the initial pilot states for this, and it is something that our Senator Debbie Stabenow has helped pioneer, and it is certainly a legacy project and program for her. So we want to be able to see it to fruition. One area we continuously hear about as it relates to workforce challenges, especially in the behavioral health sector, is Medicaid behavioral health rates. So we have funding to really be able to increase reimbursement rates and try to help achieve parity because we know our physical health reimbursement rates tend to be higher than that of our mental health, substance use disorder rates. So this is an effort to try and get us to achieve parity for individuals outside of our PIHP system. So for our mild to moderate population within our health plans. So we're, really excited about those as well. Our gambling prevention and treatment expansion is a $4 million effort. We have the ability to really be able to set this up. We may see more and more individuals interested in online sports betting And we want to be able to make sure that Michiganders have access to different ways in which they can break the cycle of gambling. Continuing on with our healthcare workforce efforts, beyond just reimbursement rates, we want to be able to expand our workforce as we grow Michigan's population, thinking about ways in which we can get new individuals, new students to consider behavioral health workforce, as well as supporting individuals who currently are in their practice and being able to offer them opportunities to move up to their highest potential within their own career ladder. So you'll see funding for continuing education as well as exam fees. We know there are certain professions out there where the exams are very expensive. And so this is an effort for individuals who may be more on the lower income tier, but want to really get into the field to be able to have a grant opportunity, a one-time grant opportunity to have their exam fee covered. We want to make sure that behavioral health professionals have access to continuing education opportunities, especially our behavioral health workforce individuals who don't make a lot of funding. And as we think about creating a new pipeline, we like to have funding for internships and scholarships for students coming in. We saw some of this funding in the budget last year, and we are setting up some of these stipends now, but we see a continuous need to be able to offer funding for internships and scholarships. We know that there are some behavioral health professions, such as social workers and more, who do not get paid during their internship time, but are required to work many hours. And when you don't have the funding while you're going through school, it can be, something that doesn't make the profession appealing. Last year, we did an increase for direct care workers. This year, we're looking at an increase for our non-clinical staff at 85 cents an hour increase. We know that not only are direct care workers working effortlessly and tirelessly, but so are the non-clinical staff. So we're looking at trying to give them an increase. And then our nursing loan repayment program, we're trying to make sure that nurses have the opportunity to have some of their loans forgiven as well. And so we're looking at nurses who work in our state-operated hospitals, as well as some nurses who work in our private sector. Last year, we implemented some of the funding from the Racial Disparities Task Force, some of their recommendations. And this year, we want to go even further because we recognize the need to continuously fund these different programs and make sure that implementation is going strong and that we're really moving the needle on some of the outcomes. So you'll see here increase $10 million ongoing for some of these programs and a $25 million one-time pot of funding with additional ARPA dollars that we have left over. So our neighborhood grant programs, you'll see funding for, and many of those programs were areas that were previously vaccine clinics that we want to convert into, health clinics so that people have access to more services. Our local healthy community zones are an effort to really help focus on everything from nutrition to exercise to other forms of healthcare services, such as understanding, your blood pressure and how to make sure that you are just living a healthier life. But it's really focused on areas that are disproportionately impacted with just poor health outcomes. So trying to make sure that people have access to the knowledge and tools to live a healthier life. Our mobile health clinics, there's more funding for that. We want to make sure that they're out there, they're moving, they're getting to some of the hard to reach places where transportation can be a little bit more challenging. And then putting more funding into our Sickle Cell Center of Excellence. which is an effort that we've funded for quite some time. So we're really excited about that. Medicaid is another area which we're very focused on. This year we're up for our Medicaid rebid, and there are quite a few new requirements that we're establishing for our health plans, but here are just a few. We definitely have seen challenges within the immunization space. With COVID, we saw that with the COVID-19 vaccine and some of the challenges there, we saw a dip in regular childhood immunization rates. And so we're really trying to focus on increasing those rates to try and find ways to increase childhood immunizations, just general immunizations. We're establishing incentive funding for nutrition services. We also are really trying to tackle social determinants of health as we do our rebid there. So those are some efforts that you'll see within that line item. We're very excited about this next bullet point, which is our incarcerated individuals reentry waiver. Essentially, this will help cover Medicaid services for individuals who are incarcerated and getting ready to exit within 90 days so that they can have a bridge to their services as they exit. So making sure when they exit and they leave, they have Medicaid and are set up and ready to go so that they can access services and there's no delay in a gap there. California did this. Ours will be structured a little different, but essentially it is the same thing, trying to make sure that they have access to Medicaid as they leave. A My Choice structured family caregiving waiver. This is similar to, not similar, but this is an effort within our My Choice waiver for seniors and their informal caregivers to be able to support those individuals who are aging in place. So currently there are some, restrictions where you have to be an adult child in order to be able to get a stipend or become a home health worker in order to get a stipend and take care of a senior. This one creates a little bit more flexibility, where if you are living in the home and you are an informal caregiver, you can be able to get a daily stipend and training as well to take care of your loved one. So really excited about that. And we want to be able to see not only this one through, but also the Caring for My Family's tax credit. As you know, the governor has been a champion around maternal health, maternal and infant health, and has been laser focused on not only reproductive freedom, but also if you do decide to have a family, you do decide to have a child, that you have everything that you need, that we are reducing maternal deaths, reducing infant mortality rates, and that we're really looking at it as well from a racial disparities lens. So with that being said, we're focusing on creating a new doula training package of funding. Doulas are one of the core areas where we see reductions in racial disparities and healthier outcomes. So we're going to up the Medicaid doula rate, in addition to not only just upping the reimbursement rate for doulas, we're going to allow for additional visits. So instead of 6 visits for a doula, you'll now be able to have 12 visits as a doula and be able to help that mother a little bit more. There'll be $2.9 million for doulas to be trained and educated. So you'll see that as well. We're also having some family planning and local grant agreement dollars to allow local public health and Planned Parenthood to be able to offer more family planning services, additional funding for centering pregnancy centers, and our regional perinatal quality collaboratives. What is not included here is some of the funding items that we have in our supplemental. We have funding in our supplemental for reproductive health services and Plan First services as well. So we're continuously investing in this area. So what I think is maybe of most interest, I think all of this is certainly highly important, but these might be some areas that the task force may be more interested in than others. We have funding for our Michigan Energy Assistance Program. So we really have thought about as well what we want to do with TANF, and I'll get there here in a moment. But how can we get funding into the hands of individuals, and how can we cover some of these services that just are more expensive and create additional barriers for families to live and sustain their lifestyles. So additional funding for Michigan's Energy Assistance Program. We're ending our birth expense recovery program, which Michigan was an outlier. We were one of the final states, I believe, to still require unwed fathers to reimburse the state for births if the mother had a child. So now we're getting rid of that. We're covering those services because it's just a bad policy. Additional weatherization support, we know that's very helpful for our seniors as well. Employment and training support for individuals who are lower income and are trying to work and get into more financially sustainable space. And like I said, housing is very important. So looking at different forms of housing support. So short-term hoteling funding, emergency housing, and more homeless shelter grants. So TANF, TANF has been a huge issue for Michigan for some time. We had our scholarship funding, private scholarship funding, a part of TANF, and TANF really is supposed to be for more lower income individuals and really making sure that they have access to funding in times of need. So we've restructured this. We are raising our income standard around the cash assistance, the family independence program. We're tripling our young child supplement payments, and we are extending the lifetime limit within the budget from the 48 months to the 60 months. We know that's something that we've needed for a long time. We will need some legislation to go alongside that, and that could be a challenge. It might not be. This would certainly be very historic for the administration if we were able to get these items through the budget, as well as any legislation that's needed and associated with this. Many of these programs, especially the Family Independence Program, has not seen a raise in the income standard since, I believe, the 90s, from my understanding. We're adding more funding to the state emergency relief bucket. We are creating $24 million for prenatal and infant support programs. So to be able to pilot different innovative approaches across cities to really be able to help low-income mothers who have children. An example of this is the RX Kids program, but local entities can duplicate or replicate a program of the sort, or they can begin to pilot new initiatives. We want to make sure that we're just being able to provide some of the best support to our mothers and infants. And then child welfare housing assistance, so that there's money there to be able to provide housing for individuals who are in our child welfare system. Keeping kids safe is a very important area for the administration every year, but certainly this year, and the budget is reflective of that. So raising our CCI rates and focusing on juvenile justice, as we did last year because of the recommendations from the Juvenile Justice Task Force. Really focusing on the MISEP strategy and improvements, being able to implement improvements so that we can move the needle from some of the lawsuits that Michigan experienced, and investing in a clothing and holiday allowance for our children and youth who are in the foster care system. I think I only have a few more slides left, but a more fair and equitable Michigan. One area I'm really excited about is being able to bolster our Michigan Department of Civil Rights. I think right now we only have around 3 offices, but if we're able to get some additional investment here, we'll be able to increase our offices, at least 2 or 3 more offices here, so that our enforcement teams can investigate, and address more areas of discrimination based off of the ways in which civil rights departments investigate some of their complaints. We have some additional funding for qualified interpreters and their certification and credentialing here in the LARA bucket, in the LARA budget. If we're able to get that through, we'll be able to help endorse more, 1,000 interpreters, which is great. We know there's a huge need there. Language services for the Michigan.gov website, so that there can be some easier translation of the content that's on our website for Michiganders. We're investing again in our My Contracting Revolving Loan Fund, which it really helps within MDOT, small and disadvantaged businesses to be able to secure their equipment and insurance they need so they can become eligible state contractors. Far too often, many minority businesses just don't have access to the capital to get the equipment they need to be able to gain access to these large contracts. You know, we're doing a lot on highways, but there's a lot that is needed to for a business to have in order to even win those contracts. So we're trying to make sure that they have access to the capital so they can get opportunities and have access to some of those higher and larger contracts. Global Michigan, making sure that we are focused on immigrant integration services and making sure that we are creating better direct connections with universities and employers for some of our immigrants who are coming to the state, really trying to grow that talent. And then ending veteran homelessness. We've invested in this space before, and so we are investing again. So there's a lot of good in the budget. I'm very excited. I cover quite a few budgets, but DHHS especially. And so I think this has been one of the most exciting budgets that I've seen in a long time. So I'll pause there and I'll open it up for Q&A. Kim, would you like me to pull my screen down, or
Oh,
I'm not sure
no,
I can see the questions.
well, Melissa's going to read some questions in the chat for you. Melissa Dansereau has joined us. Melissa,
Yeah,
is there anything in Q&A that you want to share?
yeah, there's quite a few good questions in here. The first one is asking, what is the website again where we can find more information? And this was kind of early on, so it may be regarding like the Caring for Michigan specifically, but maybe not.
So if you're referring to where you can find more information about the budget, I'll drop that in the chat here. It's just michigan.gov/budget. And on there, you'll be able to look at some of the executive budget recommendations and all the materials. You'll see the governor's presentation, boilerplate language, or the bill language that outlines the boilerplate language, just giving you more details of all of the investments we have.
Thanks, Algeria. Regarding the Caring for Michigan Family Tax Credit, must caregivers reside within the home of the family member under their care? Likewise, must the senior be enrolled as a participant under the My Choice program? Thank you.
So for the Caring for Michigan Families Tax Credit, we don't have outlined in the legislation that that family caregiver need to reside in the home. However, for the My Choice Structured Family Caregiving Waiver, that is a requirement just as a part of My Choice in general. So for family tax credit, no, but for My Choice, yes. For both of those programs, the senior or child, well, for the senior, they need to have, by a physician, been deemed that they need long-term services and support, some type of long-term ongoing care. And one area I didn't mention around the family's tax credit, it's not just for seniors. The Caring for My Family's tax credit actually also applies to children with long-term needs, and that'll be outlined in the legislation as well. And there'll be more information about that as we move through the process. But For one, yes, for one, no. But we're trying to make sure that there's access to additional capital to be able to care for individuals who need those supports.
Thank you. This question relates to keeping Michigan healthy. Have you considered animal control for stray dogs since there have been an increase in dog attacks? Many residents who are low income depend on public transportation, which may include buses. The residents will need to walk or ride bikes to catch the bus.
That's actually not something we've delved into, from my understanding. I know there's a lot of, I've heard there are a lot of desires and needs around animals. And so I'd be interested to know a little bit more around some solutions that you think might be helpful there for us to begin to discuss. And what pathways you might think we can tackle that through. But as of now, no, we have not dug into that, from my understanding.
Great, thank you. Then we have some more questions in the chat. So this is regarding Medicaid reimbursement rates. It says, we are hearing from local providers that their staff are leaving to accept telehealth positions in other states that reimburse at higher rates. Will reimbursement rates achieve national equity to address our staffing and recruitment drain?
That's our intention, right? Is to be able to look at the rates, try and achieve parity, and get Michigan's reimbursement rates up in a better manner in which they were before. I'm not sure off the top of my head, each CPT code and what that rate increase would look like. But that's certainly where it'll be helpful to have our advocates talk with the legislature, really educate them, and even push for more than what we have in the funding in order to better achieve parity. But yes, we do see that, there are behavioral health providers not only going to telehealth, but also considering private pay. And so this is really an effort to try and engage and engage providers back into our healthcare system, back into Michigan, and be able to offer broader access of services to Michiganders who need mental health and substance use disorder treatment. So I hope that answers your question. But there's a workforce challenge everywhere in this particular space, but we're really committed to trying to do as much as we can to grow our workforce, especially as we're growing our population. So hope that answers.
Great, thank you. Are there dashboards for the current program so that we can see the outcomes?
There's dashboards, I believe, or not dashboards, but there are reports, especially for Healthy Moms, Healthy Babies efforts on MDHHS's website as it relates to some behavioral health and substance use disorder services. There's some information on MDHHS's website around that, and some transparency, especially for our opioid settlement funding. But we work effortlessly to try and make sure that we are getting some outcomes here on these issues. I guess I will say, our fiscal year just started in October for FY24's budget. And so you won't see those outcomes just right away. Sometimes it takes some time to really be able to get that data, look at that data, and see where we are with some of those challenges. But our Healthy Moms, Healthy Babies initiatives have been around for a little while. So there's some initial data there that you can look at as it relates to outcomes for sure.
Thank you. What are the proposed stipends for family caregivers?
So I believe, and I can go back and look at this and probably provide you with a better response, but I think we are landing on around $70 to $90 per day. But we can get you, I can circle back with you, Kim, on that utilization rate there, but we're trying to best support in some way, in some capacity, more funding for families.
Okay, there's just a few more questions here. Are there any programs to help renters due to the high rental rates?
I think that this particular budget, I'm not sure if we have that in here. But you know, we're very focused on affordable housing and trying to make sure that there is some shelter. I know during COVID there was the rental eviction diversion program. A lot of that was federal funding. But if my memory serves me well, I'm not sure that we have that in this year's budget.
Okay, and then I'm not sure if you'll be able to answer this one, but this person asked, what does the process look like to apply for any of these programs?
Yeah, so I'm assuming you're talking about as a entity, like as an organization, versus an individual, or I can try to answer both. Whenever we have our budget year and we pass a strong budget and the governor signs a great budget, our fiscal year begins in October. Our departments work really hard to prepare for their implementation plans and strategies. And a lot of times they'll offer a proposal, a request for proposal, so a grant opportunity. And those come out on the website at different times, sometimes January, sometimes February, sometimes March. But we try to have them, you know, get the ball rolling as soon as possible. So once those RFPs come out, different organizations can apply for that grant funding. If you're referring to individual programs, some of those individual programs that individuals will apply for will be on the My Bridges link. So
Great. I'm just checking to see if there's additional questions. That's it in the Q&A. Let's see. It looks like, and I'm not sure if this fits this discussion, but someone is mentioning, would it be possible to look into some school and college policies? Someone's been struggling to graduate from college.
thanks for bringing that up. I realized I didn't put our education slides in this one. I apologize. Some of, you know, school aid fund is a completely separate bucket and beast, and then we have our general fund. So I realized I left that off, but just some quick highlights. You know, we have our summer EBT that we have in there, our universal pre-K, and continue to fund free meals, free breakfast and lunch, which I know is something that Poverty Task Force has cared a lot about. But as it relates to graduation rates and scholarship programs, we have created our new department, MyLeap, and they're very focused on that and working alongside Leo. So I think collaboration there is key. There's a lot of articles that just went out, I think it was yesterday or day before, about how Michigan's graduation rates have increased, and that's very exciting. Michigan has a lot of scholarship programs, so I would direct you to MyLeap and Leo's website for more additional information regarding those initiatives.
Great, thank you.
And now, Daria, I would just mention, oh, I'm sorry, if I could just
No, go ahead.
Go ahead.
on that, because one of the things that the Poverty Task Force has really, I think, learned by experience and knew even before we started this work, is that how important wraparound services are, you know, as it relates to making sure that people are prepared to succeed in college. You know, I know from having served as a university board member, you know, there were scholarship programs that we offered at my university. Certainly the state has great university scholarship programs right now, really trying to aggressively reach that 60% of our working adults having a post-secondary, you know, high value credential or apprenticeship or, you know, college degree, which is, you know, we recognize that we need a state workforce that has more education than what we have now. So we have great scholarship programs, but we also recognize that a lot of times, although affordability is really important, it's not the entire story. So those wraparound services for things that aren't just happen, don't just happen on campus. So things like transportation, housing, as was mentioned today, food security. So just want to mention that in our work, particularly with our scholarship programs like Reconnect, we are really intentional about making sure that the institutions can support students who need that extra push to be able to finish their degrees beyond just the tuition assistance, which of course we think is critically important as well.
Perfect. Yes. Yes.
And I
Now,
think we have time maybe for one more question. I have a methadone counselor asking how they can tap into the opioid settlement money to help their clients. Who do they contact for that?
yeah, if you go to MDHHS's website around the opioid settlement funding, I mean, there are a few things, right? If you're in a locality, locals have local funding that they are able to utilize for different programs. So I would start there with your local counties and trying to figure out what they are funding. But then we have state funding, and we have an opioid advisory task force where we have regional individuals who are sitting to help advise MDHHS on how to utilize those funds. Our opioid advisory task force meetings are public. Anybody can join those. So going on to MDHHS's website, and I can share that with Denise and Kim for you after this, to get access to who those individuals are and who you can talk to learn more about the funding opportunities there. But it's a two-pronged approach. There's local funding, there's state funding, and there's a lot of really cool, innovative programs and efforts that the department is working on and funding. So thank you for that question. I will say, even though I went over this presentation, I didn't cover everything in the budget because there's so much in there. And so I really would highly encourage you all to take a look at that website and just dig a little deeper. And then, we need your support. We want to get a budget passed, and we want to get the best one we can get passed. And, we really need strong advocates to talk to our legislature and educate them continuously on the need for these programs. So that's that.
Well, Algeria, thank you so much for sharing this information. We believe with the Poverty Task Force, we have really tried to be strategic about not only our working closely with the administration and with the legislature to uplift some of these policy recommendations that our body is making, but really to have an open dialogue with, people with lived experiences, with people who are helping people with lived experiences, with other policymakers and with other policy advocates. And that's why these webinars are so important. The governor certainly, when she established the Poverty Task Force, she did so with the understanding that, all of state government has a role in our efforts to help struggling Michiganders. It is not just something that LEO, which is my Department of Labor and Economic Opportunity, and DHHS, we don't corner the market on that. I see in some of the governor's budget recommendations, efforts to try to help our justice involved individuals. We know that housing is a critically important issue. So MISTA, with our statewide housing plan, implementing it now, the governor's commitment to build 10,000 new units of housing in the state of Michigan, knowing that our housing stock is older, knowing that we don't have adequate affordable housing in our state, and that's a huge issue. And that we wanted to have a plan where people on the ground really could identify what their local needs are. So there is certainly lots of work to do. This is multidimensional. And I really appreciate the fact that your conversation, what you presented today wasn't just the DHHS and LEO budget wins that you talked about. And we're seeing wins a bit prematurely, because obviously we know this is not the end of the conversation. Obviously, the legislature will put its stamp on this work. We know it's really important that we get it done. This is, of course, an election year. We want to try to get a budget out as soon as possible. We want to make sure that it is aligned with our values as the Poverty Task Force, and for people who support the state's role in helping struggling Michiganders. So with that, Algeria, thank you so much for joining us again
Thank you for having me.
today. Thanks to everyone who is here with us. We will definitely be having another webinar in April where we'll come back to you and talk about important issues. In the meantime, look for our newsletter that is sent out periodically that has information about some of our efforts here in the state of Michigan uh, and the Poverty Task Force. So we will continue to communicate with you, and we don't want it to be one-way communication. So feel free, if you have questions or concerns, to also email us at the Poverty Task Force. And I believe that our website, in fact, LEO, which stands for Labor and Economic Opportunity, dash Poverty Task Force at michigan.gov is our email address if you have concerns you want to share. And just follow our website to get more information. We have another, I can give you a sneak peek. Many of you know that we had two very high profile grant programs that were aimed at nonprofits. We have a third one that we will be announcing the winner, the grantees, very soon for community centers across the state of Michigan, a $64 million grant program that we're very excited and proud of. So look for that. That announcement is imminent. The organizations who were selected for those grants. And with that, I'm going to give you back about 7 minutes of your day. Thank you so much for joining us. And we look forward to seeing you in April.